I think we're ready to start. So the first person I'd like to introduce here to be with us is Lucy Warnes. She has been the Director of Engagement here at SignHealth and recently has been appointed as the Interim Chief Executive here at the charity. So congratulations.
Thank you so much.
Welcome. So the first question I'd like to ask you, Lucy, is could you tell us why we're here today?
Yeah, important question. So 10 years ago, SignHealth published the Sick of It report. You might have heard of that. And it talked about the poor access to healthcare that deaf people face. So examples like late diagnosis or even misdiagnoses, which means that their health outcomes are very, very poor. This is obviously a health inequality, and really very little has changed. We're still facing the same issues, the same barriers, the same situations. So really enough is enough. And that's why our campaign is named We're Still Sick of It. And it's a long-term campaign with lots of different activities that are being planned.
Gosh, yes, I think the title has really captured the whole feeling within the community. We absolutely are still sick of it. You're right. Then I'd like to ask maybe now, I mean, this is something that's been ongoing, these issues. Why are we starting this campaign right now?
Yeah, so maybe some of you know that we've been doing a lot of different work in the background with the NHS, really trying to exert our influence and bring these changes that we need to see. But as you know, the NHS has faced a lot of different changes, which has resulted in obviously delays and how responsive they can be as an organization. So things have been in the background, but it's really time for us to put pressure on the NHS and force them to take things more seriously. No more excuses, no more barriers. Enough is enough. But we have to remember that obviously us as SignHealth can't do this alone. We're part of the community and we need to work with the community and other deaf organizations. So we want everybody to join us in this campaign to end health barriers for deaf people. So you can help change lives for deaf people and their families.
So, wow. So the more people join, the more we empower each other. Fantastic. Thank you so much. Yes, we really want to change those minds. Brilliant. So next person I would like to introduce to everybody is Abigail Gorman. She is the Policy and Research Manager here at SignHealth. Welcome, Abigail. Over to you.
Thank you. So yeah, we're here to talk about how we really got here. So in 2014, we were looking in the community and wondering what the situation was with people with their access to healthcare. And we've really seen three different evidences of the barriers that people are facing. We did an online survey. We also worked with Bupa, the health organization, to find out how the situation that people are facing with their blood pressure and all of that. And we really found that people are facing barriers in going to their GP and getting appointments and the communication support to be able to talk to them, going to the hospital, being able to talk to consultants and really have the attention that they need. Found out that people are not being understood. There are delays that's being faced, and even as has been mentioned, the misdiagnoses. So we've realized across the board that these barriers are being faced, and we created the Sick of It report, and it's the sign that we use because, as is evidenced, enough is enough. We've been working with the NHS and we established the AIS. You may have heard of it, the Accessible Information Standard, which is embedded in law. And that was back in 2016. AIS really has 5 major parts to it. So if you're trying to access the GP or your healthcare provider, you should be able to tell them that you have communication needs and ask whether that has been recorded. Obviously, some deaf people would prefer a BSL interpreter, some prefer a note taker, some prefer a lip speaker, a deaf-blind person might prefer a hands-on interpreter. So they're supposed to ask you what your needs are. The second part of that is that they would record it in their system. So that's not something you have to say every single time. It would be recorded for you. The third is flagging. So it might be that you call up the GP and you ask to make an appointment. They type in your name, and the information that you've already provided as to your communication needs will be flagged within their system. The fourth is that if you're being referred to the hospital, for example, you don't have to go through the process, all of that again. That information should be provided as to what you require. Obviously, they should enact on that as well. If you need an interpreter, they should book an interpreter. So it might be that you need Braille, it might be that you need something in different formats, etc. All of that is encompassed in your communication needs, because this is for deaf people, deaf-blind people, deafened people, but also other people with other disabilities that might have access requirements. It's for you as an individual, but it's also maybe for the parents. Parents who are deaf and maybe they're accessing healthcare for their child. Or if you're a carer, you need to know what information is about that person who you're providing care for. So all of that is encompassed. Those 5 stages were launched as the AIS in 2016. In 2021, SignHealth thought, why not? Let's see where we're at. What changes have been made? What improvements can we see? We had conversations with the CQC, which is the Care Quality Commission, and they said, yeah, everything's fantastic. AIS is obviously working because we've received no complaints whatsoever. We were like, okay, let's see if that's true. So we spoke to other organizations, and together we spoke to 1,000 people as a survey and conducted this review. So there were patients as well as healthcare providers. 60% of professionals said that the complaint procedure isn't accessible. 40% said, yes, it is accessible. I'm able to make a complaint. Other people are able to complain about it. The question obviously begs, how do they know whether it's accessible or not? But in our survey, we found that 65% of people weren't able to make an appointment because they were being expected to make a phone call. Maybe they arrive at the doctor's surgery and there's no support, no interpreter has been booked, no note taker is provided. So 60% of people are not accessing their appointments in the first instance. When we spoke to the NHS and presented our findings and said that there were being problems experienced every single day across the board, we highlighted to them that they have a legal accountability, a legal duty to make sure that these changes are made and implemented in their systems. So we had various conversations with the NHS, with other care providers and bodies, and we realized that deaf people have been fighting for so long and something needs to be done. So that's why we set up this webinar to, under the banner of Still Sick of It, to really talk about how we are the voice of all of those different people to present the issues and the findings.
Wow, thank you so much, Abigail. I didn't realize the AIS was already embedded in law. Gosh, I thought it was just a policy or a guide.
Yeah, it's embedded in law, and it should have teeth behind it. If you want to know more about the AIS and about your rights, then Robin's going to talk a bit more about that.
Oh, perfect. That's a perfect link to the next speaker we have, who is the Community Engagement Officer, Robin Ash at SignHealth. Robin, would you like to come on camera? Hello.
Thank you, Deepa. Thank you. Thank you for those comments. I'm sure the audience out there may be wondering, well, what are we going to do about this? We know these barriers are in place. We've had these reviews. So what next? So the plans from SignHealth for the community are going to take place, and I'm going to explain this. There are 3 parts to this. First of all, we are going to deliver a roadshow. We are going to be visiting the community all across England, different groups, organisations, and a variety of places. And what are we going to do as part of part 1? When we visit you, We're not going to go straight into what the AIS is, because in different regions, there are going to be different issues. In the more rural areas, there may be different issues to what's in a central area. So we're going to ask people what their experiences are when they're accessing GPs or hospitals or opticians, and how that can link to maybe poor access and creating barriers. But you may find pockets of really good access. And why does this happen? So we need to find out what's happening out there. We will talk to people about their rights under the Accessible Information Standard, and we'll explain step by step. As Abigail said, there are 5 steps to it. So we'll go through each of these steps and explain this so people understand their right under this and what the NHS should be providing in terms of access. Once people have an understanding, what are they going to do next? So we recognise that there is a need to support the community more with resources, with further explanation. So we've planned a part 2, which is where I will return to these groups, to a second workshop, and it will be more interactive and talks about what you do. We will review and reflect on what the previous workshop did, looked at what the barriers were. If people have forgotten something or we've forgotten something, it would help us as well remember that. We want to make the deaf community more proactive so that they can fight for their rights. So the next step is, if you're going to an appointment, what do you do? So I'll give you some examples. One deaf person was very poorly. We ended up in hospital really poorly. Didn't know what was going on, didn't know what was wrong with them. No interpreter was provided. They were a proper BSL user. They went on Facebook, tried to get some explanation of what this was about with their Facebook friends. And eventually their health deteriorated so much. They didn't know what was happening, but nobody knew why this has happened, why the interpreters weren't provided. And when they looked into the reason on their computer system, the NHS has your name, your address, your medication. There should be an alert, a flag there that will talk about that individual's particular needs, including their communication needs, which AIS say they should do. It was said on this flag, this person could lip read, but this person couldn't lip read at all. They were a BSL user. So the staff thought that that person was lip reading them, understanding what was happening, but was becoming more and more ill, and their health deteriorated so badly. This happens to other people as well. Another example was a deaf person who was quite poorly, needed to see their doctor, wasn't well at all. It was snowing and ended up having to walk to the surgery in the snow and ask for an appointment. And they said, I'm sorry, there's no appointments today. They're all full. You'll have to come back tomorrow. But this person then had to go home with this illness in the snow. And then when they said, oh, there was a cancellation, they tried to telephone this person, but knew this person was deaf, even though they'd said, I am deaf. And they still telephoned them. So for a hearing person, if they weren't very well, they could pick up a phone and have that conversation with the receptionist or answer that call. And these barriers occur time and time again. That's not all. When I'm going out, these examples are shared with me, but also some good practice. One deaf person went to their GP, said, explained their needs. They logged all these in, all the needs of this person. They provided everything they needed. They added a screen above each and the reception so that people could just look when their name was called. They would text the person and she could text back. They were allowed to have emails. The interpreters were always provided. The staff were all deaf aware. And in one workshop where I went, all the deaf people there were like, where do you live? We're going to move. Because they wanted to move there because the access was so good for this person in comparison to everybody else's GP. And this is also the same with the hospitals. It differs from area to area. One area looked at improving services for deaf people and set up of the RS service for the accident and emergency. So deaf people had the confidence that, you know, if they turned up to A&E, they would have access to an interpreter whilst they had, while they organised the face-to-face interpreter to arrive. So people started to go to the A&E all the time. The NHS, we know, are trying to make people or encourage people to use other services such as the walk-in centres, but deaf people will go to the A&E department rather than the urgent care because there's no interpreters provided at the urgent care, and A&E do have, so they go there because they feel safer. So that's an example of a good bit of practice, and then where it's not so good. So it is really important that these workshops take place. And in part 2, we talk about how you feed back. And so this is why they're very interactive. We will talk about solutions. We will talk about complaints. We will talk about which people you give these to. And we have created some resources to share with people. It's also what is the process? How do you report an incident? What is the process? And it's not just about complaints, it's about compliments. You need to say well done to these organisations when they provide you really good access, because that ensures it rolls out. So this is not just for patients, it's for carers, family members. Any barriers that are seen need to be fed back. So we need that community engagement. We need to be working together, which is vital, so we can engage with the NHS, make sure that their processes improve. And when we say feedback and how we feedback, it's not always critical. They may not know, they may not have enough engagement with the deaf community. This is why we need to work closely with the NHS, feedback our experiences. Everybody has different lived experiences. We're not all the same. We're all very diverse, but coming together as a collaborative, we have more power. And we can also give them solutions by working with them to change the system. So part 3 is where we're going to try and encourage people to set up health forums where people can come together. They are already established in some areas, and they have lobbied for change because they are working more closely with the services. But we would like to offer this roadshow and workshops to the 3 workshops: Know Your Rights, How You Feedback and Influence, and how we work together as a health forum or a group of people to influence change. Working together with the NHS, with the community, and with organisational groups and clubs. So I'd like an opportunity to say thank you to all these organisations, deaf groups, deaf clubs, who have already booked or have had their workshops taken place. If you haven't and you want your group to be a part of this, you would like us to come and deliver a workshop on the Accessible Information Standard, please do contact us via our website. I mean, we won't be able to deliver things now. These are going to take time to deliver. It is a long journey to influence this change. But the reason we go out important, it's really important to find out what the issues are, where it breaks down. The deaf community, the parents, the carers are the ones that know this because they're on the ground. So working together is why we're here. No more excuses, no more barriers. Time for change. Thank you.